Right now, as you watch this, someone somewhere in the world just died from a blood clot. And by the time this sentence ends, someone else will too. Every single minute of every single day, people are losing their lives to something that, in most cases, could have been prevented. And the most heartbreaking part? Many of them felt the warning signs for years. They just didn't know what those signs meant. Today, I'm going to change that for you. Because there is a vitamin, one that you likely already have sitting in your kitchen right now, that science has confirmed as one of the most powerful protectors of your blood circulation. And almost nobody explains it the right way, with patience, with respect, with the kind of clear, simple language that you actually deserve to hear. Stay with me until the very end, because I'm going to reveal exactly which vitamin this is, show you 6 foods you can start eating today, walk you through the warning signs your body may already be sending you right now, and expose a very common mistake that 9 out of 10 people make thinking they're helping their health, when they're actually making things worse. But before we dive in, let me introduce myself. I'm Dr. Santiago Garcia, and I would love for you to tell me, right now in the comments below, which city you're watching from. It truly means a lot to me to know where you are. I've been a family doctor for over 20 years. I've sat across from farmers, retired teachers, small business owners, grandmothers who spend their whole day on their feet taking care of their grandchildren. And I can tell you with complete certainty, circulation problems are one of the most common issues I see in my office, and one of the most underestimated until the day things get serious. That's exactly why I created this channel, so that the right information reaches you before the emergency, before the scare, before it's too late. So take a deep breath, and let's do this together. I want you to picture something simple for a moment. Think about a big, busy city. Streets, highways, rush hour traffic moving in every direction. Now imagine that suddenly those roads start backing up. Cars can't move. The city grinds to a halt. People stop receiving what they need to survive. That is exactly what happens inside your body when your blood circulation isn't working the way it should. Your blood is like the traffic of that city. It carries oxygen, nutrients, and protection to every single corner of your body, from the top of your head all the way down to the tips of your toes. Your arteries are the main roads leaving your heart, carrying that rich, life-giving blood outward. And your veins are the return roads, the path that brings everything back. But here's the part I really need you to understand clearly. The veins in your legs have an incredibly tough job. They have to push blood upward, against gravity, all the way from your feet back up to your heart. Imagine trying to push water up a hill with no pump. That's what your veins do every single day. To do that, your veins rely on tiny valves. Think of them as little one-way gates inside the vein. They open to let blood move upward and then close so gravity doesn't pull it back down. When those gates work properly, everything flows smoothly. But when they weaken, and they do weaken, with age, with inactivity, with excess weight, the blood starts to slow down, to pool, to sit still in the veins of your legs, and blood that sits still is blood that can clot. This is called deep vein thrombosis, a clot that forms inside a vein. And the real danger, the thing that keeps me up at night as a doctor, is when a piece of that clot breaks off, enters the bloodstream, and travels all the way to the lungs. That is called a pulmonary embolism, and it is one of the leading causes of preventable death in the world. According to the World Health Organization, every 37 seconds someone dies from complications related to blood clots. 37 seconds. The time it takes to read a single sentence out loud. And what breaks my heart the most is this. The majority of those people felt warning signs beforehand. Their bodies were sending signals, but they thought it was just tiredness, just aging, that it would go away on its own. It didn't go away. Here's the good news, though. Those warning signs have names, they have explanations, and they have solutions. And I'm going to walk you through all of them right now. Your body is remarkably wise. It never stops communicating with you. The problem is that over time, we learn to tune those messages out. We convince ourselves that aches and heaviness and swelling are just part of getting older. They're not. They are calls for help. And I'm going to explain each one in a way that will finally make complete sense to you. And I want you to pay very close attention to the 4th sign I'm about to share, because it's the one that concerns me most as a doctor, and almost nobody recognizes it as dangerous. The first warning sign is the feeling of heaviness in your legs. Not the ordinary tiredness you feel after a long and active day. This is something different. This is the feeling that you're carrying weights attached to your feet, especially as the afternoon goes on. Your legs feel drained, lifeless. The only thing that brings relief is lying down and raising them up. What's happening inside? Blood and fluids are pooling in the tissues of your legs because your veins aren't managing to return them to the heart efficiently. Your legs are quite literally becoming heavier. The second warning sign is swelling in the feet and ankles, that deep indentation left by the elastic of your sock around your ankle at the end of the day, the shoe that fit perfectly in the morning and felt tight by afternoon. This is what medicine calls edema, fluid accumulating in the tissues because of increased pressure inside the veins. At first, it comes and goes. Over time, it can become permanent. And once it becomes permanent, it's significantly harder to treat. The third warning sign is the cramp that wakes you in the middle of the night. You're sleeping soundly, and suddenly, a sharp, stabbing pain in your calf jolts you wide awake. It feels like the muscle might tear. You're afraid to move. This is a clear signal that your muscles aren't receiving enough blood and oxygen during the night. Metabolic waste products build up because circulation isn't clearing them away. The muscle is protesting. The fourth warning sign, and this is the one that concerns me most, is changes in the skin of your legs. Feet that are always cold, even on a warm day. Skin that shifts in color, becoming pale or faintly bluish. And especially, dark or reddish patches near the ankle. These patches have a medical name, ochre dermatitis. They appear when red blood cells begin leaking out of damaged veins and staining the skin from the inside. It's as though the ink from the vein is seeping underneath the surface of your skin. When you see this, the problem has already been developing for a long time. Your body is no longer whispering, it's shouting. The fifth warning sign is tingling and numbness, that sensation that your leg has fallen asleep, like tiny pins and needles moving just beneath the surface of your skin. When blood flow becomes inadequate, the nerves begin to suffer too. And this tingling is their way of complaining. The sixth warning sign, the most visible of all, is varicose veins and spider veins, those blue or purple veins that appear on the surface of the skin. Many people assume this is purely a cosmetic issue. It isn't. They are proof that the valves inside your veins are failing and that blood is accumulating where it shouldn't be. Think of them like a warning light on the dashboard of your car. The problem isn't the light itself, but it's telling you something needs attention right now. Now let me ask you something honestly. Did you recognize yourself in any of those signs? If you did, don't panic. Take action instead. And that's exactly what we're going to do together from this point forward. This is the moment you've been waiting for. I want to talk to you about a vitamin that I affectionately call the protective shield of your veins. And I'm going to be completely honest with you because my commitment to you here is truth, not sensationalism. This vitamin does not dissolve a clot that has already formed. That would be a lie, and I don't tell lies. A clot that has already formed requires medical treatment with specific medication in a proper healthcare setting under professional supervision. What this vitamin does, and it does it very well, backed by serious scientific research, is create an environment inside your body where it becomes extremely difficult for clots to form in the first place. It protects, it prevents, it keeps your blood flowing in a healthy and steady way. And that vitamin is vitamin E. Let me explain how it works in 3 simple parts. The first part, it protects the walls of your veins. Inside our bodies, there are what scientists call free radicals. Think of them as tiny vandals. They come from pollution, from stress, from poor diet, from the natural process of aging. And what they do is attack and damage the inner walls of your blood vessels. When the wall of a vein becomes damaged, it turns rough, irritated, and inflamed. The platelets in your blood, the cells whose job it is to patch up damage, come rushing in and begin piling up at that spot. And that is where a clot can be born. Vitamin E acts like a guard posted at the door of your vein cells, stopping those vandals before they can cause harm. With smooth and healthy vein walls, blood glides through without obstruction. The second part, it makes your blood less sticky. Platelets normally float calmly through your bloodstream. They only become sticky and cluster together when they detect a problem, like when you cut yourself and need the bleeding to stop. That process is completely normal and necessary. The danger is when that same clumping process happens inside a healthy vein for no good reason. Vitamin E acts like a fine protective coating over the platelets, reducing their tendency to stick together when it isn't needed. Think of it this way. It covers your platelets with a non-stick surface, like the coating on a good frying pan. Nothing sticks. The clot doesn't form. The third part, it helps your blood vessels relax. Vitamin E stimulates the production of substances that help the walls of your blood vessels relax and open up slightly. When your vessels are wider and more relaxed, blood flows with much less effort, pressure drops, and the risk of blockage decreases significantly. It's the difference between trying to drive through a narrow, pothole-filled alley and cruising down a wide, smooth, open highway. Let me tell you about Harold, one of my patients, a 72-year-old retired bus driver who had been off the job for 7 years. A quiet man, not many words, but he walked into my office with his legs in rough shape, dark patches near his ankles, cramps nearly every night, and legs that felt heavy by midday. When I looked at his diet, it was mostly white bread, fried meat, canned goods, and soda. No leafy greens, no olive oil, no nuts, no fish. Vitamin E was almost entirely absent from his life. I didn't change everything at once. That never works for anyone. We went slowly. First, sunflower seeds added to his breakfast. Then a drizzle of extra virgin olive oil over his lunch salad. Then lightly sautéed spinach a couple of evenings a week. 3 months later, he walked back into my office looking like a different man. He sat down and said, "Doc, I slept 3 whole weeks in a row without a single cramp. I honestly thought I'd never feel that again." It wasn't magic. It was the right information applied consistently in everyday life. But before we continue, and what's coming next is very important, please don't go anywhere. I need to ask you for something with all sincerity. If what you're hearing is making sense to you, if you feel that this information could genuinely help someone you care about, whether that's a spouse, a sibling, a friend who's always complaining about nighttime cramps, please give this video a like right now. That one simple action tells YouTube that this topic matters, that it's serious, that it deserves to be seen. And when YouTube understands that, it shares this video with more people who need this information. People who may never have had access to a clear, calm explanation like this one. Please subscribe to the channel as well. It's completely free. It takes 2 seconds, and it makes sure you receive every future video the moment it's published. And tell me in the comments, which city are you watching from today? And while you're there, do you experience any of the symptoms I described? Heavy legs, swelling, nighttime cramps? Tell me about it. I read every comment, and your answers help me understand exactly what you need to hear next. Let's keep going. Nature has been incredibly generous with us. There are delicious, affordable, and widely available foods that are genuine gifts for your circulation. Let me walk you through 6 of them. The first food is sunflower seeds. This is the absolute champion. A 1/4 cup of toasted sunflower seeds, the amount that fits comfortably in the palm of your hand, gives you nearly all the vitamin E your body needs for an entire day. Sprinkle them over yogurt, toss them into a salad, stir them into oatmeal, or simply eat them on their own as an afternoon snack. They're inexpensive, available in any grocery store, and couldn't be simpler to use. The second food is almonds. A small handful of almonds, around 20 pieces, already makes a meaningful difference. Eat them as a mid-morning snack between breakfast and lunch. Beyond vitamin E, almonds are rich in magnesium, a mineral that helps blood vessels relax. It works hand in hand with the vitamin to support your circulation. The third food is extra virgin olive oil, but with one very important detail that many people get wrong. It must say extra virgin, cold pressed on the label. Read it carefully before you buy. The reason matters. High heat destroys vitamin E. So use olive oil drizzled over salads, cooked vegetables, beans, or bread. Do not use it for high-temperature frying, because then you lose the very benefit you were looking for. The fourth food is spinach, steamed or lightly sautéed with a touch of olive oil and garlic. Spinach is one of the most complete foods that exist for circulatory health. It contains vitamin E, vitamin K, magnesium, and iron, all in one. 2 or 3 times a week at dinner already produces an enormous difference over time. The fifth food is avocado. I know many people still avoid avocado because of its fat content. But I need to be direct with you. The fat found in avocado is exactly the kind your heart and veins are asking for. It's a healthy fat that protects and nourishes. On top of that, avocado is rich in vitamin E and potassium, which helps keep blood pressure balanced and steady. A serving at lunch or as a snack is all you need. The sixth food is fatty fish, sardines, tuna, and salmon. And here is the perfect combination I promised to show you. Fatty fish contain vitamin E, but they also contain omega-3, which is one of the most powerful natural anti-inflammatories that exists. Omega-3 makes your blood more fluid, easier to move through the vessels, and reduces inflammation in the vein walls. When you eat a fatty fish, you're giving your body vitamin E and omega-3 at the exact same time. It's like hiring 2 guards instead of 1. The protection doubles. And to show you just how simple this can be, here's what a protective day of eating actually looks like. Breakfast: natural yogurt with sunflower seeds and a serving of avocado. Lunch: a salad with extra virgin olive oil plus sautéed spinach alongside your main meal. Afternoon snack: a small handful of almonds. Dinner: sardines or tuna with steamed vegetables. This isn't a strict gym diet. This is the food of people who take care of themselves with wisdom and intention. Vitamin E doesn't work alone. It has partners that multiply everything it does. Let me introduce you to 3 allies you need to know about. The first ally is vitamin C. Vitamin C is vitamin E's best friend. And here's what makes that friendship so powerful. Vitamin C actually recycles vitamin E. When vitamin E uses up its energy fighting free radicals, it becomes exhausted. Vitamin C steps in, recharges it, and vitamin E goes right back to work. On top of that, vitamin C produces collagen, the protein that gives your vein walls their elasticity and strength. Flexible, resilient veins are healthy veins. Where to find it? Oranges, lemons, strawberries, kiwi, and red bell peppers. 1 orange a day already goes a long way. The second ally is dark berries and red fruits. Blueberries, blackberries, strawberries, and raspberries. These fruits contain compounds called flavonoids, which strengthen the walls of your capillaries, those tiny, delicate little vessels, and reduce inflammation throughout the vascular system. Think of them as structural reinforcement for your veins, like renovating the walls of a house that had started to crack from the inside. The third ally is water. As simple as that. Blood is made up primarily of water. When you're dehydrated, your blood becomes thicker, denser, and harder to push through your vessels. Pressure rises, flow slows down, and the risk of clot formation increases. Drinking water consistently throughout the day, not all at once, but steadily, is just as important as any vitamin or food I've mentioned here. And here's something that matters especially for people in their 50s, 60s, and 70s. The sense of thirst naturally decreases with age. You may not feel thirsty, but your body still needs water just as much as it always did. So don't wait until you're thirsty. Drink before that feeling arrives. Before we move on, I need to say something serious and clear. Vitamin E in capsule form, at high doses, should never be taken without medical guidance. The reason is the very same thing that makes it beneficial: its anticoagulant effect. In high doses, it can increase the risk of bleeding, particularly in people who already take blood thinners, anticoagulants, or even regular aspirin. If you have a scheduled surgery coming up, you need to stop vitamin E supplements at least 2 weeks in advance. Food is always the safest, most complete, and most enjoyable path. And that's exactly what I've shown you today. But whenever you have doubts about supplementation, talk to your doctor first. That rule has no exceptions. There is something I need to tell you that no vitamin in the world can replace: movement. The single greatest enemy of leg circulation is staying still. Whether you're sitting for hours in front of the television or standing in one place without shifting your weight, both are harmful. When you walk, the muscles in your calves contract. And do you know what happens when they do? They squeeze the veins in your legs and physically push the blood back up toward your heart. That's why circulation specialists refer to the calf muscles as the second heart. Every step you take is a pump that drives your circulation forward. 30 minutes of walking per day makes an enormous difference over time. It doesn't have to happen all at once. 10 minutes in the morning, 10 in the afternoon, and 10 in the evening works just as well. Can't manage a walk today? Then, right there in your chair, you can already help your circulation. Flex your foot up and down as if you're pressing a gas pedal. Roll your ankles in slow circles, one direction, then the other. Rise up on your toes and lower back down 10 times in a row. These simple movements activate the calf pump and keep your blood flowing even on the days when walking isn't possible. At the end of the day, lie down and elevate your legs above the level of your heart for about 15 minutes. Place a pillow underneath them. Let gravity do the work for you. The pooled blood drains back naturally. It costs nothing, requires no equipment, and does a world of good. And before we finish, I want to tell you about a very common mistake that seems helpful, but actually isn't. Many people wear compression stockings, which is a wonderful thing to do, but they wear them at the wrong time. They put them on after the legs are already swollen at the end of the day. That way they don't work properly. Compression stockings need to go on in the morning, right after you get out of bed, before any swelling has had a chance to develop. That's when they truly do their job. We've reached the end, and I want to leave you with a clear and simple summary of everything we covered today. First, vitamin E is the protective shield of your veins. It guards the walls of your blood vessels, reduces the tendency of blood to clot where it shouldn't, and helps your vessels stay relaxed and open. Science confirms this role clearly and consistently. Second, the best food sources are sunflower seeds, almonds, extra virgin olive oil, spinach, avocado, and fatty fish. Include at least 3 of these in your daily routine starting today. Third, vitamin E has powerful partners: vitamin C, dark berries, and consistent hydration. Together, they form a complete team for the health of your circulation. Fourth, vitamin E supplements at high doses require medical supervision. Food is always the safest route. Fifth, and most important of all, if you experience heavy legs, frequent swelling, nighttime cramps, skin changes on your legs, or if varicose veins or blood clots run in your family, schedule an appointment with your doctor. This video informs. It does not replace medical care. It never will. What hurts me most as a doctor isn't when a patient arrives with a serious diagnosis. It's when they look at me and say, "Doctor, I'd been feeling those symptoms for years. I just thought it was part of getting old." It isn't part of getting old, and you don't have to accept living with heavy, painful, swollen legs while believing there's nothing to be done. You have the power to change your health, and it starts with what you put on your plate and with the daily decision to move your body, even if it's just a little, even if it's slowly. If this video opened your eyes, please share it with someone you love. That friend who always complains about nighttime cramps. That family member who has been living with varicose veins for years. Sharing this information is a genuine act of love and care. In the next video, I'm going to reveal the 5 everyday habits that are silently damaging the circulation in your legs. And one of them is going to genuinely surprise you because it seems completely harmless. You won't want to miss it. I'm Dr. Santiago Garcia. My mission is to reach you with quality information, with respect and with care, so that you live longer, live better, and live with greater health. Take care of your legs. They carry you through every single day of your life. See you in the next video. Você diz, calm B.